the past 2 years, the impact of the COVID-19 pandemic has been felt by millions of people. For healthcare workers, the stress and burnout caused by the virus may be felt for years to come. As CBS 6's Tracy Sears reports, recently passed legislation named for a Virginia native is aimed at helping healthcare workers find the help they need.
This is really an extension of her light.
Dr. Lorna Breen loved caring for others. Medicine and family were the cornerstones of her life. But the physical and emotional toll of serving on the front lines as an ER physician in New York was too much. Breen died by suicide in the spring of 2020 at her family's Virginia home. Now, nearly 2 years later, there's legislation in her name aimed at helping other healthcare workers across the nation.
Lorna would be delighted right now. And having it named after Lorna, who cared so deeply about her colleagues. I'm truly worried about their well-being above her own. This is really an extension of her light.
Corey Feist says his sister-in-law's legacy will continue through the Dr. Lorna Breen Healthcare Provider Protection Act.
My constituents.
Legislation introduced last year by Senator Tim Kaine and recently passed by Congress to help struggling healthcare providers.
The mental health side of this, though, is going to take years, really decades, to get through.
Kaine says he hopes the Breen Act will prevent more suicides, burnout, and the mental anguish so many healthcare workers are still experiencing, despite being called heroes in their communities.
Sometimes it's harder for somebody on a pedestal to say, I need help. The way we should call them healers, that's the compliment, and then make sure that they have the resources they need so that they can get healing when they need it.
A recent Medscape survey shows that 1 in 5 doctors is contemplating leaving the workforce. 2 out of 5 nurses, many reluctant to seek help for the fear of losing their jobs.
This goes very, very deep, to a point where this was one of the reasons why Lorna took her life.
Through grants, studies, and public awareness campaigns, Feist says the Breen Act will hopefully change policies and the stigma associated with mental health issues.
That recognition is what we're hearing from across the healthcare community right now. This thank you, someone sees us.
It's what Feist says Lorna would have wanted, her light serving as a beacon of hope for others.
Like many who lost loved ones during the pandemic, we had a private celebration of her life with 5 or 6 people in our backyard after she died. But so many, we need to pause, we need to celebrate this law, we need to celebrate Lorna. And we're hoping to do that.
Thanks to stimulus funds, 46 institutions have already received grants totaling $103 million. Here in Virginia, George Mason University, UVA, and VCU Medical Center all receive funds to help create change for healthcare workers across our state. For You Are Not Alone, I'm Tracy Sears.